Welcome to the Health Admin Life podcast. My name is Brooke, and I'm going to interview special guests to explore the vast career opportunities in health administration. Whether you're a clinical professional, a corporate worker, a student, or a patient yourself, this podcast is for everyone. Get ready to be inspired.
Hello, current and future healthcare leaders. Welcome to the Health Admin Life podcast. My name is Brooke, and today I'd like to welcome Michael Goldberg, previous president, CEO, and CFO of Long Island Jewish Medical Center of Northwell Health, and now founder and CEO of his own company and board member of Counselor. Michael, can you tell our listeners a little bit more about who you are?
Yeah, Brooke, thank you so much for having me on the podcast today. It's wonderful to see what you're doing for current and early careerists and in healthcare. There's so much opportunity and growth that people can experience in the healthcare field, and I'm excited to be here with you today and tell you a little bit about my journey. So as you said, I founded and created a company called Walk Alongside Leader after over 2 decades in healthcare, where I started as an intern in the finance department and then worked up to being the CFO of a billion-dollar hospital in New York City, transitioning from there into operations and then ultimately becoming the hospital president CEO also through the pandemic. I then decided that there's so much opportunity that we have in the healthcare space to really transform the experience of our team members, to make sure that healthcare is the place that people will always choose to be where they want to work. There has been so much difference over the last several years about the perspectives of healthcare in general from the population, but also from the team members. And we've seen over the last couple of years, almost 20% of people who worked in healthcare prior to the pandemic have left. Now, they've either left to leave the field completely, or they've left to find another aspect of the healthcare field to work in. And I think that there's a great way that we can potentially bring them back by changing the face of leadership. And so that's why I formed the company Walk Alongside Leader, to take some of the ways that I implemented strategies to connect with our team members, connect with our community, and to show them for the humans that are caring and compassionate that they are, and help them feel that they're living a rewarded life, not only for the interactions they have for the patients that they're caring for, but that they're seen and that they're heard by the public and appreciated. And so that's why I created Walk Alongside Leader. And I love getting out there and helping people and coaching and helping companies achieve their goals. The other side of what I'm doing right now, which you referenced, is I joined the board of a company called Counselor, which provides 24/7 mental health support via an app, which it was created initially for college students, and it was created pre-pandemic. And if you've seen any of the news and statistics around the mental health pandemic that I believe is happening, where starting at very young ages, the numbers of people requiring mental health is increasing at astronomical rates. And the number of psychiatrists and psychologists that are estimated to that we're estimated to be short in this country is something like 35,000. And so Counselor is filling the gap in order to help make sure that people have access 24 hours a day whenever they need it, and have the opportunity to talk and help and get support. And so they asked me to join the board. When I joined, the company was focused on colleges specifically, and now it's in a corporate environment where companies can complement and supplement their traditional EAP programs by making sure that their employees have access to confidential and truly anonymous mental health support. And we're also now seeing a very large growth in high schools. And so I very much enjoy a lot of my time continuing to make an impact in the health space by being a member of Counselor.
That is fantastic. I know that you have so many wonderful experiences, and I think people would love to know a little bit more about maybe what some of those positions look like, whether it's on the hospital side or more of the entrepreneur side. Can you tell us a little bit more about maybe one or two of those positions?
Yeah, like many people that are in healthcare administration, I think I entered into it not knowing what the opportunities are that are in the healthcare space. Growing up, when you pictured a healthcare field, you think about a doctor and you think about a nurse and you think about the clinical care team. But when I had the opportunity, graduating college, to have a few different internship opportunities, one was on Wall Street at Merrill Lynch, and the other one, simultaneously being presented to me, was at Northwell Health, which was previously called something else. But what I found was, when I walked into a finance office, a corporate finance department, looking for an internship, 7 miles away from the closest hospital that they were supporting, was a group of people who were incredibly caring and compassionate. And they recognized that every single analysis that they did, business plan that they put together, or piece of work that they did that had a number on a spreadsheet was actually representing a patient receiving care at the bedside, and that they viewed every part of what they were doing as a way to help the caregivers have the tools that they need in order to care for the people. And so I've, between the two choices of being on Wall Street and the health system, I worked on Wall Street for the 3 days, and I said, "Thank you very much. You're a great group of caring people in a different way." But this just felt like it was much more aligned with my personal values, and so I took the more longer term internship at Northwell. And at the end of the summer, was presented with an opportunity to transition from being an intern to an analyst in the finance department, where we put together the budgets for a 13 hospital health system at the time. There was a $3.5 billion capital budget, which I learned how to put together, implement, and learn how to fund. And we were the department that worked on all the business plans for every growth strategy or divestiture strategy for the organization, while also working with representatives at New York State for getting all of those plans approved in order to move forward. And um, so I learned very early on, number one, there was this entire field of healthcare finance. And that led me more towards healthcare administration, because healthcare finance interacted with strategic planning, facilities planning, the people that design the buildings, price out the buildings, build the buildings, the operational leaders who run the buildings or run their departments or run their businesses, the clinical leaders who provide the services. And it became this entire world, an ecosystem, if you will, of opportunity for just learning and finding ways to continually make impact in the care of the community that we were serving. And that felt very rewarding to me.
That is awesome. And I know you mentioned that you started out as an intern. So how long have you been in this industry for?
Uh, 23 years.
Wow. And I know you mentioned working and starting out at Merrill Lynch, going over to the healthcare side. You transitioned from, I believe it was the COO to the CFO to CEO. How was that transition?
Yeah, slightly, I'll reverse the order a little bit. So I
Okay,
worked in corporate finance for 9 years in that office
wonderful.
7 miles away from the closest hospital. And then after 9 years of progressively growing through roles, I started as an analyst, senior analyst, manager, senior manager, assistant director. I filled in as an interim vice president, although I wasn't given the title, I was given the responsibility, and I was working directly for the chief financial officer of the entire organization for a couple of years during that time frame. And after a new leader was brought in for that department, I was invited to go to the hospital as the chief financial officer. And it was a dream, because right now, the hospital that I worked at, Long Island Jewish Medical Center, is the second largest hospital in New York State. It wasn't at that time, but it was very large. It was $1 billion budget. And so I jumped at the opportunity, not because of the size and scale of the scope of the facility, but because I felt like, as a growing finance leader in healthcare, the best way that I could serve the company and ultimately the community was to be in the field somewhere, to have a job where I worked close to where the care was delivered. And I had that opportunity when I was invited to go and be the chief financial officer of the hospital. It was also at a very exciting time, because a multi-year project, the largest hospital expansion project in New York State that we worked on as a business planning side of things and the strategic planning side of things, was being built. And so I had the opportunity to transition not only from putting the business plan together, lobbying for it to get approved with the New York State officials in Albany, but then going to the hospital and helping to operationalize it, and then ultimately pay for it, right? Make sure that the business plan assumptions were real, and partner with the team, the leadership team at the hospital, to achieve them. And so I went to the hospital after 9 years of being in corporate, then had an opportunity to go to Dartmouth College in a program called the Master of Healthcare Delivery Science. And it was a new degree that was created based off of President Obama's campaigning that he did in 2008, where an anonymous donor gave Dartmouth College $35 million to bring together 50 healthcare leaders to truly transform the way that we think about delivering healthcare in this country. And they did it by coming up with a unique program that brought together the medical school and Tuck Business School in order to bring the most robust curriculum together with leaders to do this. And at the end of that program, I was again invited to change careers and take this 13-year finance trajectory that I had been on and get to that, proverbial fork in the road and say, you can continue down this road of finance, but, Michael, we see something different in you. We see that, you think a little operationally when you're strategizing around the finances. Would you consider being the chief operating officer of the hospital? And so, mentors are an important part of anybody's career, and I had a very important mentor in my life. I actually had two, and so I visited with them and I spoke to them, and they said, give it a try and see how it works out. And so I did. And then a year later, I was asked to take on more operational responsibility. My title changed slightly. And then the year after that, I was asked to be the hospital president or CEO. And so I guess that the finance thing was a good transition.
That is awesome and honestly a very impressive background. And I know you had a very long career starting out as an intern, but to get to where you are now, I think a lot of people are probably wondering, well, what skills does it really take to be in a C-suite position in an organization? Are there any competencies, whether it's soft skills or technical skills, that you would recommend building for young leaders?
Yeah, that's a great question. There's a lot that goes into being in a C-suite. There are some consistencies that I think you can display all along your career in order to stand out, be the person that people want to work with, and ultimately be competent in what you do, right? And so the first thing is to act with tremendous amounts of integrity, right? Healthcare is a great field where we have what I think is the most noble mission out there, and that's to help another human being. And if you approach every work product with the opportunity to remember that at the end of every project, even when the days get difficult, is somebody relying on that organization to take care of them when they need them most, you'll always make the right decision and you'll always act with integrity. And it'll never be about, what do I have to do to get the next job? It will be, what do I have to do to make this the right organization to care for our community? And people will gravitate to that, right? People want to work with you because of that. And the people who are in things for themselves will they'll stand out in a different way. You have to be curious. You have to ask questions. And that's constant. When I got to the hospital in 2009, I was relatively confident in my ability to do math, right? I could do the finance side of things. I was going to learn some finance at the hospital, but my goal was, how can I learn as much about the hospital as possible? So I told my boss, I said, don't expect to see me in my office all the time with spreadsheets in front of me. I'm going to be in the hospital building as many relationships as I can and learning what goes on. So I sat down with the chief medical officer at the time and I said, what are some things that I should see, do, and experience, right? Then I did the same thing with the chief nursing officer. And then I made lists, right? Observe a case in the operating room. Do a shift overnight in the emergency department with the team. Round with an interdisciplinary group of people. And I just asked for these things, right? And it's no different than what I did when I was in corporate. I remember there was one day the Northeast experienced a blackout and our office got shut down. And I was a very junior employee at the time. But I happened to know a couple of the hospital presidents because of the work that I was doing. And while I was driving home and there was no traffic lights and it was unsafe, I was leaving the building that had just been closed down. I put a call into one of those hospital presidents and I said, hey, listen, I don't know what's going on in the hospital, but I know that it's not normal. And if you need an extra pair of hands, I'd be happy to come and help however I can. I'll deliver meals, I'll move patients, whatever I can do to help, just let me know. And while he didn't take me up on the offer, he appreciated the offer, right? He said, Michael, that's really generous of you. The hospital is staffed okay, but appreciate the offer. And I will tell you that as a leader of a hospital, I offered that proactively to many corporate partners who would say, hey, I'd like to learn more about the hospital. And I'd say, well, then just come and volunteer, right? Not not volunteer from the standpoint of you joining the volunteer office, but come and experience it. We'll create a spot for you. And in 12 years of making that offer, I had nobody take me up on it. Nobody. In an organization that I think today has 85,000 people, right? So if you want to know what one of the things that I think it takes to stand out, it's to express interest and be curious and then put yourself out there to learn and grow. Where I did see people find experience, and one of the reasons why I created this company called Walk Alongside Leaders, because when I was the CEO of the hospital and I started to create my social media platform and build trust with the team, I invited people to invite me to join them for a shift in their job. So now as the CEO, I said, hey, if you'd like Michael Goldberg to come and shadow you for the day, put a post on here on Instagram. And a bunch of people responded. And it never stopped. Even as the CEO, it was still important for me to show people that they matter and that they're appreciated and to show interest in learning what they do. Because as a leader, it doesn't matter what level you are, but as a leader, you have the opportunity to make somebody's experience better. And sometimes as a leader, you make decisions and you don't understand the impact of those decisions unless you see it, right? And so after that Walk Alongside campaign, I worked as a patient transporter for a day in the hospital. I worked as an ICU nurse, and when I say worked as a nurse, I'm not clinically competent to do anything, but I shadowed them, right? And they spent a lot of time teaching me. I worked as a clinical impact nurse, which is the team of people who respond whenever there's a code, somebody's decompensating. So I spent a day watching them perform heroic efforts. I did a shift in the emergency department with an ER nurse and a med surg nurse. And no, that's not the only time I've done this, but you stay curious. And if you stay curious with the final expectation, I think that's important is to always find a way to say yes to people, right? A lot of people get into leadership positions and the very first thing they feel like they need to do is exert their authority, and their gut reaction is to say no when people ask them, like, I'm the boss, can't have that day off, you have to come in. My approach is always to find the yes. So when people would approach with ideas and questions, it's important to recognize that, number one, they feel valued and heard if you listen to them. They feel dismissed and disgruntled if you just say no. And so in all roles that I've ever had, it was always yes, right? When I was in a finance office and I learned how to write reports before there was easy ways like BI and other systems to just pull things that anybody could pull, we had very intricate systems that we had to learn. And it didn't matter who needed information. When they'd come and they'd ask for help, my answer was always yes, even if it meant I had to work longer, even if it meant that the work that I was doing, I had to put on the side for a moment. We worked very long hours in those days, and so I just always found ways to help other people, and that's finding the yes.
I think that those main three things are great advice, whether it's integrity, curiosity, or even saying yes. When it comes to integrity, I think a lot of us always, I don't want to say always, but at one point in time, you're probably going to end up in a hospital. And I think that as a leader, you have to make decisions. Like you said, you'll have an impact. So it's important to always lead with integrity. Now, with curiosity, I think that there's so many intricacies of the healthcare delivery system, and even within an organization, there's always going to be things that you don't know. And being on the front lines, you don't get to see that as a leader every day. And I think that it's great that you took the time to go into the hospital and to see what it's really like. And this reminds me of the Undercover Boss, the TV show. So I think that's awesome. I think that's unfortunate that no one took you up on the offer, but it even gets me thinking. I work mostly remote, and I'm like, what are ways that when I'm on campus that I can make an impact and that I can shadow more? What are little things? And I know what was awesome last year, I had a roommate who was a nurse, and I saw a different perspective from her than from what I'm seeing. So it was a great learning experience. So always stay curious. And then the last one, saying yes. And this one reminds me of the job doctor Tessa on TikTok. She actually wrote a book and she talked about this, where if you say no, to collaboration, whether it's working, let's say you're in the strategy department and you're working with marketing. If you say no, that closes the door and it makes them think that you don't really care about them.
Mhm.
So if there's a way to possibly say yes, or if you have to say no, explain the why. I think that's really important as a leader. So I appreciate you sharing your perspective on this and the qualities and skills to work on as a leader. Now, this kind of segues into my next question and bounces off of that as well into the pandemic. But before getting into that, is as a leader, no matter what position you're in, I think that you have to have a balance between the information that's told to you, but also if it's not positive, you have to try to still think of the silver lining and be positive, but also to an extent be transparent with your team. How do you navigate that as a leader, being positive but also being transparent?
Yeah, it's another great question and an important one because I think what's the foundation behind having people respond to you as a leader is the trust that you build with them when the times aren't tough. How do you treat them every day? How do you appreciate them? How do you respect them? And how do you demonstrate for them that you're the type of person that they should follow? So, as I mentioned, I started this on day one. I started as the CFO. I walked into a place where not only were people afraid of finance, they were afraid of all of leadership, and the culture there it was a no culture. And it was worse than a no culture. The culture that existed when we arrived was that if they asked for things, they would be told no. But worse than that was they would be yelled at for asking.
Mm-hmm.
And so we had to change that dynamic. And part of me getting out into the field and learning how people were doing their jobs was to recognize where there were opportunities for providing them with support of resources that they didn't have and they might not have been asking for. And so I started putting together business plans for people in the hospital that I would have to approve as the CFO, right? So imagine the CFO coming to you. Most people were afraid. Okay, the CFO is walking in the door. Don't tell him anything. He's going to take away our stuff, right? Whatever limited stuff they had. And I walked in and I'm just like, hey, you know what? I was here the other day and you guys were working on this thing. I think you can use a few more people. And they're like, yeah, but how's that going to get approved? I'm like, well, this is how we're going to get approved. If you have those people, do you think that A, B, and C are going to get better? And they're like, yeah. And I'm like, okay, well, that's a return, right? It may not be a financial return, but it's a return on quality. It's a return on safety. It's a return on efficiency. That's got a value. So let's put that down. Do you agree that you can achieve that if you have these people? And they'd say, yeah. I'm like, okay, then here's the approval on the paper. Go hire those people. Go start recruiting. And then time after time after time, you build trust with the team and they start to see you as an ally as opposed to somebody who's there to be bureaucratic and obstruct them
Mm-hmm.
from doing what they want to do. And then as you've built up that trust and they know that you're really in the business for the best interests of the patients and the company, when you have to tell them the hard things, they respect you for it. They know that it's not because you just say no all the time.
Mm-hmm.
They know it's not because you're exerting authority and saying, well, that wasn't my idea, so no, right? Which a lot of people do, and those are insecure leaders who behave that way. So as you bring up the pandemic, we did an employee survey in 2015, right before I took over as CEO, and then we did another one about 18 months after. Right before I took over, our employee engagement score was in the 40th percentile, so 4 out of 10 people were happy coming to work. And I was like, well, that's not acceptable, right? How can all these people, almost 10,000 people come to work every day and not be happy, 6,000 of them not be happy? So I took the survey home. I read through every comment because most of them are just the standard multiple choice type of answers, right? But
Mm-hmm.
then there's a place where people could write in their comments, and I was the only person at the hospital allowed to see it. No names are in it because unless people wrote their name, which nobody did. I was given a 5-inch binder of all the comments that thousands of people wrote. And I took it home on a Friday, and I sat down and I spent the entire weekend reading it, categorizing it, and figuring out what the main themes were. And some of them, so now I'm the incoming CEO getting to read the thoughts of everybody. It's almost like Bruce Almighty, right? You get to hear all the voices. And some of them made me really great and happy and proud of what I was taking over. Some of them made me really sad, and I felt bad for the way people poured their heart into the way they were feeling and being treated. And some of them just made me angry because people would demonstrate in their comments about how their leaders were making them feel and how they were being treated. And so I knew that we had to change something. But one of the things that showed up in that survey was that they told us we weren't talking to them. And I knew that we were already sending communications out on a regular basis, right? Every Friday we sent a newsletter, it was an email. And it's where I realized email is the illusion of communication, especially in healthcare, right? Where the vast majority of people that work in care delivery systems, like actually where the care is delivered in hospitals or large medical offices, they're not at their desk, right? They're not the viewpoint that I had when I was in corporate, where I was sitting in front of a computer most of the time. And when an email popped up, I could read it. The vast majority of the people, they're delivering food, they're moving patients, they have hands-on patients while they're providing care. They're in an operating room. They're not sitting in front of a computer when they're operating. And they don't have an interest or a need or a desire to go log on to a computer at the end of that shift and see what we said to them. So I started talking to the team at the hospital. I said, you know what, we have to change the way we communicate. We have to be where the people are, right? Where do they want to get their information? And it's some of how we've connected now, right? So in probably 2017, I created an Instagram account and I said, I'm going to start communicating on Instagram. This is going to be the main channel, because you walk through the hallway, you see them in the elevator and they were scrolling, right? The thumb is doing the thing. And you go to the cafeteria and they've got their pages up. And so I started communicating where they are. And we took, not only from that, but we made some other changes. And we took our engagement score from the 40th percentile to 90th percentile. So 4 out of 10 people turned into 9 out of 10 people being happy coming to work there, because they started to feel appreciated. They started to feel listened to. And I feel very strongly that if I didn't do that groundwork for the years leading up to the pandemic, we wouldn't have had the type of positive response, as difficult as it was. And there were difficult days, especially during the first wave when New York got hit hard and first. And there's some data that supports that we were the hospital that was most impacted with the most severely ill patients in the world at one point in time. I don't think I would have had the credibility to be there alongside the team, leading them through such uncertainty, with as many of them showing up with that sense of positivity that we could have as we went through the pandemic. So I don't think it could be the moment where things are difficult, where you can be a leader who gets a team to respond, if you don't do it when times are good.
That makes complete sense. And I think that this was an incredible story. And thank you so much for sharing this. And maybe a little question following up on it now that we're on the topic is, what was your experience like during the pandemic? And I know, like, as a CEO, I think many people are wondering, how did you make those decisions? What was that experience like?
Yeah, so there was a tremendous amount of uncertainty. There was sparse information. It was challenging because as a non-clinical person, you rely on your clinical team. And when your clinical team can't provide information on how are you going to treat the people when they come, how is this being transmitted, are we even safe coming into the hospital, not only for us as administrators, but for the team. It's a really hard way as a leader to stand up in front of your team and give them confidence that you're going to lead them through something when there's so much uncertainty. And the best way that, just following up on that last question, that I think we were able to do that was having built a level of trust, being the type of leader who was there, right? So at a time when the world was shutting down, the healthcare workers had to show up. And there were healthcare leaders all around New York that went to other states or they went to their vacation homes and they didn't show up. I didn't not show up. I mean, I basically lived at the hospital, and there was a policy that came out from our corporate team that said, you've got to have an A team and a B team so that the entire leadership team, if you get infected, doesn't get quarantined for 14 days and there's no leadership. And they were pretty insistent on the fact that we divide up, and we did divide up. But I also recognized that we were on a 48-acre campus. I think there was enough room that I could be on campus every day, and when it was the B team's day to be in the building, I could be in the building too and never see them, right, and still be separate. And that's the type of leader that I am. But I also remember walking through the ICU the very first day that there was a COVID positive patient in the hospital, and I was with the chief medical officer, and we walked in, and the entire care team, they immediately gathered around us. And they had a lot of questions. And it was, same things that you would imagine. Why are we the first unit to have the patient? Right? There's 20 other places you could have put the patient. Why'd you put them here? That was the first question. The second question was, they had a traditional procedure mask at that time, right? Because it was when it was just starting. They said, why is this enough? How do we know that we're safe? When you put on the news that was on every patient's TV, you saw China and you saw Italy in full hazmat suits. And here we have a procedural mask. And we stood in front of them and we said a few things. One was the WHO and the CDC can't agree on what the right protective measure is. But here's the CEO of the hospital and the chief medical officer of the hospital, who presumably would have more information about how to stay safe than anybody else in the hospital, right? And we're wearing the exact same protective equipment that you are. And we will continue to have exactly the same experience that you will have here from a safety perspective. And so when we know more, you'll know more. And when we have different information about what's going to keep us safe, you'll have the same protective equipment. You will never have anything that we don't have access to. And I remember there was one nurse who stands out in my mind because at first she was very, animated about us not having the answers. But by the time we left and we were walking out of the unit, she actually chased me down, and she turned around. She's like, "Hey, I just want to let you know I'm sorry about that. We're really appreciative that you're here. It means a lot to us. We know that you're going to give us the information that that you have when you have it." And she looked at me and she goes, "I don't know exactly what's going to happen next, but I know I'm going to be a better nurse for it." And any amount of uncertainty that I had about how we were going to get through the pandemic dissipated. Because to answer your question about positivity, the mindset was already there. We already had a foundation for, positivity, teamwork, collaboration. Our mindset there was always to find the yes. And I think that made our experience, I'll go on a limb and say, better than others, right? And it was hard to always stay positive. I mean, it was incredibly hard when you'd hear not one code happening overhead, but you'd hear multiple codes happening overhead and know that multiple people were, passing away simultaneously, and the bells overhead were telling us, right? The bells, the announcements. I'll give you an example of what that means. So on a typical day, you'd have one code announced overhead on the paging system in the hospital, right? For a 24-hour day, you'd hear one, medical rapid response required somewhere. At the peak of the pandemic, it was happening every 37 minutes. And it's hard to be positive on days like that. But I can remember one day where there was a patient spot in the hospital, one bay out of 9, actually no, at that point it was probably like, 900 beds. And patient after patient after patient, 6 of them in one day, in one spot, passed away consecutively. And the leader from that area called us in administration and said, you can't send us another one.
Mm.
We just can't do it. And I'm the type of leader who was responding to a lot of those calls, not to put hands on patients because I'm not competent to, but to be there for the team and to let them know that they were supported, and to let them know that if there was anything that I can do to provide them with resources that they didn't already have, we would get them. And that included mental health support,
Mhm.
because a lot of times when you're in healthcare and a care team experiences a loss, they have to just move right on to that next patient, and they don't get a chance to process the feelings that they have. Again, another reason why I joined Counselor, because I believe that Counselor is a perfect tool that belongs in the hands of every healthcare worker in this country. And there's difficult days, and sometimes you need to just go in the break room and talk to somebody, or people just needed to cry, and they need the space and the permission to do that.
The pandemic was not easy, but I think, at least for me, I am really thankful to know that there's leaders like you out there who instilled trust in their staff. It's a choice to be positive and to be transparent, and there is a balance, but I think that you've found the right way, and I hope that this message gets out to other leaders to lead in that same way. So thank you for sharing. Now, I know we're coming up on time, but I do want to ask a couple more questions or let you
Sure.
choose a couple more. Now, one that I thought was fascinating that we talked about before was surrounding the documentaries around Northwell Health and how to have the decision-making power. Another question is, if there was something you could improve within the health care delivery system, what would it be? And then the last one is more on the transparency of pay and compensation for healthcare leaders. If you are able to answer these quickly, I'm happy to listen, or if you would like to choose one for the next few minutes, feel free to pick which one you would like to choose.
Well, I could probably do two of them pretty quickly. You mentioned the documentary. I didn't say it earlier, but for your listeners and viewers that are out there, in the beginning of the pandemic, we were reached out to by a award-winning director, Matthew Heineman, and he wanted to document what was going on. And so at Long Island Jewish Medical Center, we welcomed him in and his team with no idea about what we were going to capture in the footage, but he did produce a film called The First Wave, which follows the journey of a few patients and their families. And it was important to me as a leader when it was presented to us to say yes, not because we knew we were going to be the hospital that was the most impacted, but because the media was not allowed in the hospitals. Our own video production crews weren't there, and we were going through a historic event. And to me, it was important that you capture as much as you can from an archival perspective so that we can learn from it and make sure that when the next disaster strikes, we can do it better, while also at the same time, capture the important stories that happen. And Matt did it very, very well. So if you're on Hulu or National Geographic, you can find The First Wave, and it shows a glimpse into a portion of what we lived through at the hospital. I think the question that would take longer, maybe even that we have time for, is what would I change about the healthcare system? I think there's two parts. One is to start off with the company that I founded. It's the way that leaders engage with teams, and the second thing is how we prioritize wellness and prevention in this country. So it's really a two-part answer. The first one is, it scares me to think about all the families, that 20% of people that left healthcare that I talked about at the beginning. It scares me to think about the conversations they had at their dinner tables with their families, in front of their children, siblings, younger people that they influence, what kind of careers they're going to choose for the next 15 or 20 years. We're already seeing the devastating impact of hospitals that have to either shut down or curtail their services, and gaps in care that are being provided. And if we don't change the appreciation and the leadership style that we have for our team members in healthcare, we're never going to inspire that next generation of healthcare workers to ensure that as our population grows, which it's anticipated to grow, our healthcare system can't shrink. It actually has to grow alongside of it. And the other thing we know is as the population ages, more and more people require care. And so I'm very passionate about making sure that we have the right type of leadership in place to reverse the damage that was done during the pandemic. Started great and then took a turn in the opposite direction. The second thing is prevention and wellness. I brought a lot of programs to the hospital. I built a gym that was available for the team 24 hours a day, 7 days a week. A former Peloton instructor came to the hospital and provided a workout for the team during the pandemic outside. Also did some other stuff virtually for the team and changed food pricing and all sorts of things to recommend ways that we can inspire our team to live healthy. I think it would be great to see a way that our government, the insurers, and healthcare leaders take very seriously the aspects of care that we prioritize in our healthcare delivery systems so that effectively we have one goal, and that's to make the healthcare system not needed. And not needed by providing ways for us to all live as healthy as possible, right? There's always going to be reasons why things happen that it will be needed.
Exactly.
But the worst thing you could do as a healthcare leader is cheer on the fact that you had few more trachs or ECMO patients or neonates in your P&L for the month. And when you hear that in your organizations, you know that somebody lost their way.
And I think, like you said, it's a balance between having the right leadership, but also the government involvement and the way the healthcare delivery system is run. And that's not easy. And I think it's awesome that you are taking that first step in preventative care. And I think more people need to take that initiative. But to be courteous of time, I want to say thank you again so much for taking the time to chat. This has been wonderful. Is there a way for people can stay connected with you after this show, Michael?
Absolutely. And thank you for the invitation. I very much enjoyed the conversation and look forward to staying in touch with you as well. For all the listeners out there, I'm on just about every social media platform that's out there at Michael H. Goldberg, TikTok, now Threads, Instagram, LinkedIn as well is where you can find me. And I look forward to connecting with as many people as possible.
Wonderful. Then on that note, I just want to thank everybody for listening. Today's show is brought to you by our sponsors, Riverside and Spotify for podcasters. To listen to more episodes, check out the link in my bio at Health Admin Life on TikTok, Instagram, or YouTube.